Hi YouTube, Christian Brindle here, and I'm back with another Medicare-centric video here for you. And we got a lot of positive feedback on the other Medicare supplement-centric videos for Colorado, Idaho, Utah, amongst the other ones we've done. So we thought it'd be fun to bring you one today where we discussed California Medicare supplement plans. Now, in a state as big as California, there are going to be different prices on different parts of the state. California is so big, it's almost like a Texas or a Florida or a place like that, to where it's almost like a couple different states all mushed into one. So Sacramento might have different prices than Los Angeles and vice versa. So I just put in a Los Angeles zip code for the time being. I thought it'd be fun for us to look at a Plan G. Of course, the prices we're looking at are as of August 14th, 2020. These prices are subject to change. So if you're watching this video down the road, the prices might not be exactly what is quoted here today or what we're seeing. Basically what a Medicare supplement is, for those of you who don't know, is it's going to come through and fill in the gaps of Medicare. So Medicare Parts A and B work like two pieces of a puzzle. They fit together to give you medical coverage, hospitalization coverage, surgeries, doctor's appointments, durable medical equipment, lab work, etc., etc. They're typically going to pay 80% of those bills and leave 20% behind after some deductibles are met. What Medicare supplements do is they're programs through private insurance companies. They're going to come through and pay those deductibles and the 20% that Medicare leaves behind, although different supplement plans pay a different percentage of what Medicare leaves behind. A Plan G pays for everything that Medicare leaves behind with the exception of what's known as the Medicare Part B deductible, which is $198 one time a year. It's a very popular plan, probably the most popular plan in America right now. So I thought that would be a good indicator just to get an idea. And we're going to run a quote based on a female who's turned 65. So let's get right into it and see what things look like in California, Los Angeles specifically. Oh, it doesn't like my zip code. Sometimes it wants me to just put in forward there. All right, now let's take a look. Based on the zip code we are looking at. All right, so it looks like at the moment, in this particular scenario, in this zip code, for a female turning 65, some companies give lower rates to females than males, so it could be a different price if it's a male turning 65. But it looks like the cheapest Plan G you can get at this very moment is with Blue Cross Blue Shield of California at $135. Now I always like to look at rate increases. So we're going to turn on the market analytics on this quoter engine I have here. And it looks like this particular plan or this particular line of insurance has essentially more or less been relatively new to the market. It looks like as of last year they didn't even have this plan available. It looked like it just came out for this particular line of Medicare supplements. It just came out this year, which is interesting. So we will continue to go down. We also have Blue Cross Blue Shield of California, which it looks like this is not one of our companies, but it looks like this is essentially the same company. So I wonder what the difference is. I'm not sure. Anthem, Blue Cross Blue Shield, which is incredibly popular. And their rate increase history is very impressive. It's gone down 4.9% average over the last handful of years. It had a negative 28% rate increase in 2013, so that's very, very impressive. Then you have AARP, Medicare supplements insured through United Healthcare. They've only had a 2% rate increase since 2018, which is very impressive. Didn't have a rate increase this year, so that's a nice sign there. National Health, which is basically National General, they're relatively newer to the market, but not too new. They haven't had a rate increase as of yet, so there's not a whole lot to go off of. But as of last year, they only have 33 insured lives in the state, which I don't know. I don't love to see such low numbers there. Thrivent doesn't look too bad on those rate increase histories either. Transamerica. Recently, looks like the last 2 years, they've had a 7% and a 9% rate increase, which I don't like to see that. National Guardian, Loyal American, which is a Cigna company. Overall, not too bad at 4.6% over the long haul, but this year having an 8% rate, 10% rate increase just a couple of weeks ago from when recording this video, so that is a little troublesome in my opinion. You kind of get the idea. I mean, there's all the companies that offer a Plan G is the same plan. They're standardized, so it's the same. It's just they all have different costs and also rate increases. You also have a United American, which is a company that's been around a very long time in Medicare supplements. Now, if I was looking at, let's say, a Plan N for a female that's turned 65, we can kind of take a look at that as well. Plan N is the same plan as a G in a lot of ways. It also doesn't cover that one time a year Medicare Part B deductible of $198. It also comes with a couple doctor copays, or up to $20 for a doctor copay, could be less, $50 for an emergency room copay, and it also doesn't cover what's known as the Medicare Part B excess charges, although we typically don't see doctors charge that. In some states it's not even legal. But we look at United, they actually have the lowest plan and price right now with the AARP plans in this area, and they have a long track record. Look at this. Since 2013, they've only had a 2.6% rate increase average. I mean, how about that? Blue Cross Blue Shield of California has had a 14% the last couple of years. That's nothing we like to see. Cigna's been very good, it looks like, since 2015, 3%. National Health still doesn't have a history there yet. National Guardian doesn't look too bad, but not a lot of history. United American looks very promising. Continental Life, which is an Aetna-owned company, 2.4%, which is good. So you kind of get the idea here, folks. Humana, 4.6% since 2014. Everest, Transamerica, Anthem, Blue Cross Blue Shield, Combined Insurance. And anyway, folks, this is basically a little bit of a rundown on California Medicare supplement plans. If you enjoyed this video and if you'd like to talk to us about Medicare supplement plans in California, we are licensed there and we work with a myriad of the larger providers and larger insurance companies. Give our office a call. I'm going to put it right here on the screen big. We also work with people in the states, in 9 other states. If you'd like to, for a full list of those states, check out the description down below. And thank you so much for watching. If you enjoyed this video, drop a like on it and subscribe for future Medicare and insurance-based content. Have a great day. Take care.